Hi, my name is Bruce Kaufman, and I work and live in Northville, Michigan. I have the Bruce Kaufman Agency, and I specialize in people turning 65 with their Medicare insurance options. Now, Medicare was enacted into law in 1965 by President Johnson, and President Truman was Medicare's first enrollee. Now, Medicare consists of four parts. Part A is for hospital costs, so when you have to go to the hospital, it's going to pay for that. Part B is non-hospital fees like doctor's visits. Part C is something called Medicare Advantage, which is a combination of Parts A, B, and D, and Part D is your prescription drug card. Now, when you turn 65, you have numerous choices for your health insurance. A lot of people are still working, so you could still stay in your company's group plan, but that can be very expensive. You could purchase a Medicare Advantage plan, but these Medicare Advantage plans have hidden copays within the policy. However, if you qualify for low-income subsidies, a Medicare Advantage plan will have very minimal out-of-pocket costs. Or you could purchase a traditional Medicare A and B with a standalone Medigap or Medicare supplement plan. This usually works out best for most individuals. Now, Medicare Part A will cover hospital stays. So just remember, Part A is for when you go into the hospital, it's going to pay most of your hospital costs. But you're still going to have to pay an annual deductible and co-pays for your Medicare Part A, which can be very costly. Now, there is no cost for Part A if you or your spouse worked at least 10 years and paid Medicare taxes. Now, Medicare Part B will cover your expenses like physician services, lab tests, home health care, outpatient hospital treatment. Medicare will cover a majority of that cost, 80%, but you still have to pay an annual deductible for Medicare Part B and your annual copays. Now, there is a cost for Medicare Part B. It's all dependent on your income. For example, if you file an individual tax return and your annual income is $85,000 or less, your monthly Part B premium will be $104.90 per month, and that's for this year, 2015, the same as 2013. If you're filing a joint return, that cost is going to be still $104.90 per individual. Now, the monthly Part B premium increases up to $335.70 per month if you have income above $214,000 for individuals and $428,000 for couples. Next, we have Medicare Part D, which is the prescription drug card. This is how this works. First, you have a deductible of $320. I sell United Healthcare's plan. They have a great prescription drug card, and there is no deductible with this plan. Now, after you meet your deductible, up to $3,000, $2,960 in annual drug costs, you're going to be paying 25% of your drug costs. The plan's going to pay 75%. Now, after you hit $3,000 in annual drug costs, up to $7,062, that's called a coverage gap, where you're going to be paying for brand name drugs 45%, and for generic drugs, you'll be paying 65%. So once you hit $7,000 in annual drug costs, above that, you're only going to have to pay 5% for your drug costs in the catastrophic coverage area. Now, there's basically two choices. You choose your Medicare insurance coverage. You could go with original Medicare, that's Part A, Part B, then you pick a prescription drug card, then you pick a separate Medicare supplement insurance policy or Medigap policy to pay for your deductibles and copays. Or you could purchase a Medicare Advantage plan which combines Part A, Part B, and usually Part D into one plan. But be very careful, review these Medicare Advantage plans, because if you do have health conditions, you are liable for up to $6,700 in additional annual out-of-pocket expenses. Now let's look at an actual comparison, what I did for a client of mine. The red is a Medicare Advantage plan, and the blue is traditional Medicare with a supplement policy. As you can see, in the Medicare Advantage, we use Blue Cross Blue Shield's Assure PPO. You can go to any doctor. The monthly premium is $283, which includes your prescription drug card, but you do have that annual out-of-pocket copay of $6,700. So if you have a lot of medical expenses, that will add up. So if you have a lot of medical expenses in this scenario, okay, if you take that $6,700 divided by 12, with your monthly premium, you could have a total monthly cost of $841 a month. So you have a total monthly cost of $283, which is an annual cost of $33.96. Okay, and if you add on this $6,700 for an annual out-of-pocket copay, this Medicare Advantage plan could cost you $10,000 per year. So what I do here is very unique. What we do, we take 4 separate policies. We take the United Healthcare Plan F, the supplement plan, which is going to cover all your deductibles and copays for Part A and B. You see any doctor in the United States, so it's a PPO. That monthly premium is $143 at $65. There's no annual out-of-pocket copay. Then we put you into United Healthcare's ARP prescription drug card, $44.20 per month. So it's $44 a month. Then I put you into a really excellent dental, vision, and hearing plan. You can see any doctor. It's a PPO, so you're not limited to doctors. That's a monthly premium of $35 with an annual out-of-pocket copay or a $100 deductible. Okay, so we're going to get you an excellent dental, vision, hearing plan. And this plan is better than most teachers' plans, okay, that are out there in the market. Then I do something very unique here. Cigna Insurance Company, they have a special policy. It's called Flexible Choice. It's $56 a month. And you can pick and choose. So in this scenario, if you're diagnosed with cancer, heart attack, or stroke, you're going to receive a $5,000 immediate payout. Now, if you have to go to the hospital for any reason, we can pay you $100 a day cash. This goes to you. It doesn't go to the insurance company. I mean, we could go from $100 to $1,000 a day. So depending on your budget, we could fit you into a plan that meets your needs. So in this scenario, if this person went into a hospital for up to 20 days for a heart attack, they're going to receive $2,000, okay, and a $5,000 immediate benefit. So your total monthly cost for all 4 policies are $286. Your annual cost is $34.32. But if you do have to go to the hospital for cancer, heart attack, or stroke, which most people, when they get hit with something, a serious health condition, that's what it's for, we can pay you $5,000 immediately to take care of any additional expenses. So really, you could have a max annual cost of $0 if you utilize this Cigna health insurance policy if you really get hit with a severe medical condition. So as you can see here, this traditional Medicare plan with the supplement policies are really going to be more beneficial and cost effective for you in the long term. Okay? Again, my name is Bruce Kaufman, and you can always reach me at my direct phone number, 313-549-1880, and I look forward to helping you on your Medicare insurance options. Thank you.